After spending last night in the Health Department's budget lockup and also in Parliament House talking to ministers and advisors, we can give you a quick overview of the health budget for 2015-16. The Prime Minister said that this budget was going to be boring, and I think in relation to the health portfolio that's a pretty good description, mainly because most of it was already announced before the Treasurer gave his speech. So overall Commonwealth outlays on health will be $69.7 billion for 2015-16, which is up $2.3 billion on the current year. The government has announced it's essentially going to adopt all of the recommendations into its review of the electronic health record, which of course was chaired by APHA President Richard Royal. They've also allocated $485 million over 4 years to redevelop the health record, to trial opt-out arrangements rather than the current opt-in arrangement, and also to transition to new governance structures. And we've already had some discussions with the Minister about involving the private sector in that process. There was $624 million announced to list new cancer drugs for breast cancer and melanoma. And it was also announced that the entire Medicare benefit schedule would be reviewed. And the reason for this, and I quote, is to consider how services can be aligned with contemporary clinical evidence and improve health outcomes for patients. So in a practical sense, I think what that means is that some MBS items may not attract a rebate unless they're used in particular circumstances or for well-defined patient cohorts. It may also mean that some MBS items are removed from the schedule if no evidence base can be found to support their use. Last year, the government announced that it was going to merge 7 agencies within the health portfolio to form a Health Performance and Productivity Commission. But after consulting with the states and the agencies themselves, it seems that plan has been shelved, although the department has said it will continue to explore strategies to find efficiencies and reduce the number of agencies within the portfolio, but the reference to the new commission appears to be gone. There was confirmation that funding for 100 or up to 100 internships in private hospitals has been allocated, and also funding for 900 specialist training places in expanded settings, which of course include private hospitals. Health insurance hospital membership is forecast to increase from 10.5 million to 11.3 million over the next 4 years, and the government has also reaffirmed its commitment to restore in full the policy settings around the rebate, and that includes removing means testing. We're still just going through some of the fine detail in the papers, but we hope to have a full written report available to members by the end of the day.